Hi, I'm Dr. Brian Long, interventional cardiologist, and welcome to Health Talks from the Inside Out.
Dr. Brian Long, Chief of Cardiology here at Williamson Health. Thank you for joining me today.
Well, thank you for having me, Michelle.
Yeah. So you are actually an interventional cardiologist.
That's right.
So we're going to get into what that means in a minute, but I like to begin these conversations by just asking, what drew you to medicine? How did you get to where you are?
Sure. Well, when I was really young, I wanted to be a doctor when I grew up.
Okay.
And then as I came to learn that doctors go to college and then medical school and then residency and maybe a fellowship, that was a little intimidating to me. I don't come from a medical family. And so, through meeting with guidance counselors and talking to friends who were pre-med and even some family friends who were physicians and a lot of soul searching, I decided and realized that a career in medicine would really combine what I thought were my strengths and my goals in my life and career, and decided to go for it.
That's great.
Yeah.
So walk us through, did you think cardiology from the beginning or did that present itself throughout med school?
Early in med school, I remember in physiology class learning about the heart and cardiovascular system, and immediately interested. I just was fascinated by it, and then med school, you were exposed to all kinds of specialties on our rotations, all types of surgery, primary care fields, diagnostic fields like radiology, pathology. I came to realize cardiology combined what I liked about all those. We, especially interventional cardiology, spend part of our week with procedures, and I like that, working with my hands and the interesting and sometimes exciting procedures that we do. The clinic side, where many of our patients we see regularly over their lifetime and really develop relationships and get to know them and their families. And then also the imaging and diagnostic side, we look at a lot of cardiac imaging, echocardiograms, other types of tests. So the field just seemed to fit, and then just having a real interest in just cardiovascular physiology and heart disease and such, it really stood out, and the more I learned about it, the more it was going to be an easy decision for me. Yeah.
That's good. Okay, so I want you to share with us what you learned that was so fascinating about the heart when it grabbed you. What is something that we might not know about our heart?
Well, from the science side, there's a lot of technical things that were really amazing, but I guess it's just sort of amazing facts about our heart. Our hearts beat about 100,000 times a day.
Wow, okay.
About 2.5 billion times in our lifetime. In a day, the heart, which is really a pump, pumps about 2,000 gallons in a day, which could fill a small swimming pool. Yeah, 2,000 gallons with each total over each beat. And it also generates enough energy to power a truck for 20 miles in a day. So it's just an amazing organ.
Yeah.
It just keeps going.
Yeah, I think you've just made the heart really cool. So
All right.
Maybe some future cardiologists out there.
Yeah, maybe.
Yeah. Okay, so I introduced you as our Chief of Cardiology. Can you explain what that means and what that role entails?
Sure. My role at Williamson Health has several parts to it. I'll start by saying at Williamson Health, we have two cardiology groups or practices that work there and work very well together. One is Vanderbilt Heart at Franklin, which I'm part of, and we're all Vanderbilt faculty who do our hospital work, consults and procedures and such at Williamson Health. And there's the Ascension St. Thomas group, who's also a large group now and has all the support of the greater St. Thomas cardiac network. So one role for me is to be somewhat of a liaison between the groups to make sure that both are getting the support and opportunities that they need at the hospital. I'm also I chair the cardiology committee, which is a group that meets every 2 months. We deal with current issues, whether it's changes to the medication formulary affecting cardiology care, to workflow and protocols for procedures and things. That part's relatively simple because there's such good people at Williamson Health that do their roles in there so well that mine's kind of organizational in that sense, all for the sake of always trying to improve and be the best we can. And so in that sense, I kind of have a role of somewhat of an overseer of things going on in cardiology at Williamson, which I've enjoyed, to really kind of have a good overview of what's going on with both groups and all over the hospital.
Right.
Yeah.
And I love that you did mention both groups, because a lot of people, I feel like, don't know that.
Sure.
That we have two different groups, the Vanderbilt group and the Ascension St. Thomas group, and we just feel so blessed to have both of y'all, such great groups. And you're right, everybody does work so well together. So
well, we do, and I agree, it is a strength actually, in many ways, but one is that, you know, different practices may have different strengths, and individuals have more experience in one facet of cardiac care than another. I mean, on a daily basis, we communicate, you know, between obviously our own colleagues in our group and across to the other. It's been a really, really great setup for us and for the patients, frankly. So,
And here at Williamson Health, y'all practicing at Williamson Medical Center, we do a wide variety of cardiac services. We don't do everything that's out there, but can you break down what services we do provide here,
Sure.
and then what services we might work with another facility to help get that done?
Well, starting with the second, we don't do open heart surgery. With passing years, more and more cardiac conditions are managed non-surgically without what people consider open heart surgery.
Yeah.
And so there are more conditions and situations that we're able to treat safely and effectively. As far as the services we provide, it's really the whole spectrum of heart disease, starting with preventive cardiology, which is really helping identify patients at risk for developing heart disease, or maybe have the early stages of heart problems that we can intervene early, whether it's lifestyle changes, medications, whatnot, to, you know, diagnostic testing of all types, to diagnose specific cardiac issues and follow them and follow our treatment. Interventional capabilities, of course, which we'll talk about, but that's interventional cardiology is really treating mostly coronary artery disease with invasive angiograms or arteriograms. We're essentially imaging the coronary arteries by injecting them with contrast or dye through catheters and getting really clear looks at them. And then if needed, opening arteries via angioplasty and putting stents in them and other techniques that we use to open arteries. Rhythm problems, it's called electrophysiology, is the specialty of cardiology that deals with heart rhythm problems, whether heart rhythms are too fast, something like atrial fibrillation, or slow heart rates and heart block that need pacemakers. We're equipped to deal with all those types of things. Congestive heart failure is becoming a specialty in itself, which is basically the heart's not effectively pumping blood, either from being too weak or too stiff of a heart muscle. We have specialists in both of the groups at Williamson Health that are really expert in congestive heart failure management. And then, you know, on the backside of heart, surgery and procedures is cardiac rehab.
Right.
Williamson has an outstanding unit. I mean, they've been such a key part of our patients' recovery from anything from heart attacks to surgery, physically, and certainly the emotional and psychological part of recovering from a new heart diagnosis. And so, we're really proud of what Williamson offers in that whole spectrum of heart. Yeah.
And you mentioned having specialists in heart failure, but really all of those areas you mentioned, from prevention to the intervention to the heart failure, each of our two groups has specialists in all those subspecialties, correct?
That's correct. Yep, we do. And again, in a place like Williamson Health, one thing I like about it is we each do a bit of all of those things.
Okay.
In more of maybe a tertiary heart center, subspecialists probably stay more in their lane, so to speak, or really their own focus. It's one thing I've enjoyed in my career here is while I have a focus there and spend part of my week directly with coronary disease treatment, in clinic I see all of the above, and I like that.
I like how you've said before that you and the other interventional cardiologists are the plumbers.
Yes.
And the EP guys are the electricians.
That's right.
So expand on that a little bit.
Sure. In a sense, it's glorified plumbing. We have to find ways to sometimes remove acute blood clots in a heart attack situation, or deal with chronic plaque in an artery that can be very calcified, making it very stiff and hard to deal with, much like rust in an old pipe that doesn't want to budge. And only it's obviously much more, delicate probably.
Yeah.
But it's in a sense the plumbing, and then you're right, the electricians are the electrophysiologists who deal with the the rhythm system of the heart. Yeah.
Yeah.
Yep.
So we were so proud a year and a half ago to have our grand opening of our new Boyer Bryan West Tower. And on the bottom floor of that is our new cardiac center. Can you walk us through what's there in our new cardiac center?
Well, sure. Yeah, we are very proud of it, and it was such a great event when that opened for us. Well, starting with the cath labs. Okay, that's cath lab means catheterization laboratory, which is where we perform coronary angiograms, arteriograms, same thing, heart caths. But the technology has changed so much, and so the two new cath labs are absolutely state of the art. I think back 20 plus years ago to my training years, and the images we got compared to what these digital imaging cath labs do, it's incredible, the improvement. And that really improves everything from our ability to do procedures precisely to outcomes from them. They're also safer. The radiation output, these are X-ray machines essentially, is much lower, so less radiation exposure to the patient, the staff, the doctor, who are all in the room. They call it 𝐅𝐫𝐸 is much better with these newer labs. And there are lots of other technical aspects that allow us to take on sometimes more challenging or complex cases in the cath lab for coronary intervention because of the different tools that the new cath labs have, ways to assess vessels in different ways. So those are the cath labs. Then there's also our first ever electrophysiology lab, EP lab. What they do are things dealing with heart rhythm. So implanting pacemakers, permanent pacemakers, defibrillators, they kind of look like a pacemaker, but they are implanted in patients who have, say, a very weak heart that's at risk for like a dangerous arrhythmia, like we call it ventricular arrhythmia, which can be, cause a cardiac arrest. A defibrillator is put in kind of prophylactically in some of those patients, and which is basically watching for those rhythms and would deliver a shock to convert them to normal and essentially save the patient's life in many cases. Wow. So all that's done in an EP lab. And then they also have capabilities to do what's called ablation for arrhythmias. Right. And so rhythm disturbances in the heart can be treated lots of ways, including different medications. But the more definitive treatment would be an ablation of an arrhythmia, where the EP doctor enters the inside chambers of the heart with special catheters and essentially kind of map out the short circuits, if you will, of the heart that are causing the atrial fibrillation or SVT, whichever the rhythm is. And then they can essentially ablate the short circuit. In years past, that would involve heat or freezing of tissue. They're now using what's called radio frequency ablation, which is more like an ultrasound type thing, which is even less potential for being traumatic to the heart. So all that's done in an EP lab, which we have our first ever. And as I said earlier, electrophysiologists from both the St. Thomas and Vanderbilt groups that are using that. Yeah. We have a whole new pre and post procedure area with 10 to 12 beds. It's fantastic as far as the patient experience from when they get checked in and prepped for a procedure to going back out there after whatever their cardiac procedure was. We also have improved imaging machines such as echocardiograms. And then going from there upstairs, the cardiac ICU upstairs is an intensive care unit. Is just the best I've seen. The facility is fantastic. We've always had wonderful intensive care staff and nursing up there, but it's just really a seamless progression for a patient. They may come in the middle of the night with a heart attack, straight into our cath lab for us to treat their blockage, right up to an ICU that's state of the art. It's really been a tremendous upgrade for us. Yeah.
It truly speaks to what we talk a lot about, and we say that we're continually elevating our services here. Mm-hmm. And this is a great example.
Absolutely.
We're not just saying that, we're actually doing that, and so proud of our cardiac center.
Yes, that's absolutely true. And to be more technical about it, in interventional cardiology, one challenge we face that I'll explain in interventional cardiology is when plaque forming in a coronary artery has a lot of calcium in it. It can make the plaque very rigid and very hard to treat with traditional measures, which is what we call angioplasty. That's essentially a small balloon that's inserted over a wire into an artery by the blockage. and inflate it at high pressure to expand and basically break up that plaque, then to put a stent in and expand the stent. If there's a lot of calcification in that plaque, that doesn't really work so well. And so we need ways to deal with plaque before we're going to try to balloon or put a stent in properly. One new technology is called a shockwave balloon, which has really allowed us to take on cases here that previously we wouldn't be able to. It's a very atraumatic or safe a way to deal with that. Essentially, it's like an angioplasty balloon that delivers high intensity shock waves into this plaque,
right?
And essentially breaks it up into very small particle size that loosens it such that a stent will expand perfectly. Previously, that would require much more invasive ways to people use the word roto-rooter, but actually, in a sense, drill out some of this calcified plaque, which carries more risk and wouldn't be done at a hospital without heart surgery on site. So it's one example of something that's been added in the last couple of years at Williamson that's really allowed us to safely treat some of these more complex coronary blockages.
Wow. Of course, we're sitting down with you and we're hearing a lot from the physician perspective, but there's a whole team of folks that assist y'all in the cath lab and the EP lab, and we're also super proud of those folks. We have a great team.
We have a great team, and I've always been impressed with their dedication. I think some of it stems from just the community feel of Williamson Health. A lot of our staff, have grown up in this area or at least live nearby, and they just, there's really a sense of this being our hospital, and not just a job. And so that's kind of the personal touch of Williamson Health that I've noticed from being at other or larger heart centers. Patients are each step of the way, I think, really get really personalized care. The physicians here really seem to take their time, talking to patients, explaining things to the family, never in too big a hurry to go sit with the family and make sure they really understand what we found, what we did, why we did what we did. And then, then as I said, patients are sometimes then admitted upstairs to the different units where those nurses are just fantastic in their, post-procedural care.
Yeah. And at the same time, you're being woken up in the middle of the night to come in. Some of the staff is as well, because
that's right.
They have to be there to assist y'all with what you're doing.
That's right. It's called what we call the STEMI team. STEMI is ST elevation myocardial infarction, which basically means an acute heart attack. And when someone arrives at our emergency room with a STEMI or is picked up by one of our ambulances in the field at their home or elsewhere, and they do an EKG and recognize a STEMI and notify our emergency room that they're coming in with this, well, the signal goes out to the physician, the interventional cardiologist on call, and the staff, which is a nurse and two technicians. They're all on the same call team that night. And everyone has to be here. There's a time limit because the clock's ticking as a patient, needs to get to the cath lab. And their commitment to this is just amazing. So
it's really top notch.
It is.
Yeah. And I'm glad you mentioned STEMIs and our primary heart attack center. We're going to have our next guest, Dr. 𝐇𝐞𝐚𝐥𝐭𝐡 is going to come in and talk all about our primary heart attack center. So people have to tune in and listen to our next episode.
They really should, and that's really a great accomplishment. Just a couple of years ago, we were accredited as a primary heart attack center.
It also makes me think, of course, February is Heart Month, and so we're doing a lot of promotions around cardiology and our services. Can you talk a little bit about the importance of people knowing CPR and how to use an AED? We have some videos we're putting out to be tutorials, but we find that so many people don't use those things when we really want to encourage folks to do that.
That's right. So if someone has an out-of-hospital arrest, as we call it, their best chance of survival and with a good outcome is to have immediate CPR, and that's called bystander CPR. Many of us at some point through school or Boy Scouts, Girl Scouts, somewhere had some of that, but that years go by and people just don't refresh that, and it's pretty simple these days. In fact, anybody can learn to do this and do it right. AED is the same thing. Schools, churches, stadiums, they're all there. I think we should kind of make it a point during Heart Month to pay attention to that, know where they are at places we all go.
Right.
Also very simple to use. It sounds scary for non-medical people to think, I don't know if I could do that. Like actually be the one to put that on someone who's had an arrest and is unconscious and hit the button. It's that easy.
But they really do have step-by-step instructions.
Yes.
No matter the brand of AED, it will audibly walk you through what to do.
Yeah.
And we find that so many people just think they don't want to make it worse. I'm
Right.
not sure what
Yeah,
to do,
I
so
think
I don't
so.
want to hurt the person.
Yeah.
I don't want to make them worse.
Right.
But if somebody's in cardiac arrest, it's already a dire situation.
Oh, you
right?
can't
so
make
you're
it
not
worse.
gonna.
No, that's
you're
right.
not gonna make it worse.
That's the part they need to realize. Like anything you do is going to help.
Right.
And so, I think it's a good time. Heart Month's in general a good time to just kind of focus on heart health and what can we do. We often focus on preventive cardiology, but I like that thought of a community message to learn CPR. You can do it online. Now there's courses, obviously with Red Cross to be certified, but even to just know how to do it. And
you're right. They've made it more simple, and so now it's hands-only CPR,
Right.
and it's just fast and hard.
Yep,
right?
that's right.
That's what you do.
And again, if someone's doing that and is getting tired, the next person steps in. But we've seen, in my career for sure, just amazing stories of people surviving out of hospital arrests who had good CPR until paramedics arrived, and then they got the treatment in the hospital that they needed.
So for everybody listening or watching, go to our social media pages, our YouTube page, and we'll have some videos on both AED use and hands-only CPR.
Wonderful.
So I know you are privileged to care for anybody that comes in your office, but what are some simple things people can do to hopefully avoid getting to your office?
Sure. Well, preventive cardiology, it largely lies in primary care. So I would say number one is have a doctor.
Yeah.
Adults need to see a physician every year, and a lot don't, because they feel well. They don't want to see a doctor unless they have a complaint. But primary care providers focus on identifying risk factors that lead to heart disease, blood pressure, cholesterol, diabetes, addressing lifestyle issues like smoking or obesity. So I would definitely, step one is to have a primary care, and that that goes a long way toward identifying risk for heart disease and hopefully preventing heart disease. Outside of that, a heart healthy lifestyle, I think a lot of people know it but don't follow it. It's getting regular exercise. I'd say at least 4 days a week of something aerobic. It doesn't have to be ultra strenuous, but something that gets the heart rate up a bit and is sustained 25-30 minutes, something like that at least. And people always ask, well, what should I do? And I say, well, the heart doesn't have eyes. It doesn't know what you're doing. It just knows it's beating faster.
Right.
And so, regular aerobic exercise helps in so many regards, right? From keeping blood pressure down, helping lose weight. It helps with cholesterol. And then, a healthy diet. There are lots of ways to eat right. Whole grains, fruits and vegetables, lean meats, minimizing cholesterol, and simple sugars, of course, can lead to diabetes and weight gain, which are, especially diabetes, a major cardiac risk itself. So, a balanced diet with the components I mentioned, and of course, calorie control. Americans struggle with weight. We know that's a major thing. Cutting calories is the best way to lose weight. The American diet on average is about 70% carbohydrate. The rest is protein and fats, the rest of our calories. And so cutting carbs is why people lose weight when they do that. It's not necessarily that carbs are so evil as much as it's such a large percentage of our diet. And of course, again, talking with a primary care provider about things like that.
So we've talked a lot about our overall cardiology services and offerings for our patients. We've talked about how for the past several years we have been diligently working hard to elevate our overall cardiac capabilities here. Can you talk about why that's important to Williamson County and our community members?
Yeah, well, by elevating our services, I think of the facilities themselves and the improvements we've made, including the technological advances that have allowed us to advance our care, to expanding our service line with different subspecialists in cardiology. What it means to the community is that we have really a full service cardiac center right here in Franklin in Williamson County. And I want to add to that, the EMS system is integrated,
Yes.
with our hospital, which is pretty unique, in a town this size. It allows patients to establish cardiac care here in their own community, and feel confident that we've got everything covered, from preventive care to anything that may be diagnosed and needs to be treated, to long-term follow-up in our great office practices here. I think it's no longer the case that patients need to go to downtown Nashville for that level of heart care, and those are great hospitals. But we're here for the purpose of bringing quality heart care close to people's homes. Yeah.
Do you have a memorable patient story that kind of has stuck with you all these years?
Yeah, many that I could tell. I guess one that happened here at Williamson a while back that just kind of an amazing situation and story. A gentleman that was driving on I-65 south from, I want to say, somewhere in Kentucky to a family wedding in Alabama.
Okay.
And he was just still north of our exit.
Okay.
And had actually called his wife saying, something's wrong, I'm having chest pain.
Right.
He was driving on his own. Well, turned out our blue hospital sign was what he saw next, and he literally got off the exit to get to Williamson Medical Center. He parked his car and came in and had a cardiac arrest walking in the door.
Yes.
Not even into triage yet.
Right. Wow.
Hit the floor.
Yeah.
Got him to the cath lab. Sure enough, he had occluded the big artery in the front of the heart that would do this. It was a relatively simple procedure to get that open and stented, and he left the hospital maybe 2 days later.
Okay.
Actually, doing very well.
Yeah.
Very minimal damage to the heart. He missed some of the pre-wedding stuff, but he had several days. He actually made it to the family wedding. And I mean, it's incredible on so many levels, but I mean, obviously his guardian angels were watching that he made it.
So what would you say is the most rewarding part of your job?
Getting to know my patients and being able to, know and treat them over years. It's really a unique field in my part of cardiology that we can see someone from, their worst moment that could happen to them, and then see them through that and treated through that, and then have a long time doctor-patient relationship for many, many years. It's just really special.
Yeah. That's great.
Yeah.
Well, Dr. Long, thank you so much for joining me today. It's so great to have you as we celebrate Heart Month.
Well, this was a lot of fun. Thank you for having me, Michelle.
Yeah.